Manufacturers of face masks are stepping up production at facilities around the world, including this US factory in South Dakota. But with demand far outweighing supply, there are concerns that key personal protection equipment, including face masks, will be in short supply.
These are the N95 masks, so this means it excludes 95% or more of these like tiny 3 micron, so 3/1,000,000th of a meter, tiny little particles.
Predicting the demand, Chicago-based Northwestern Medicine says its hospitals stocked up early.
If it goes months and months and months, there's always the possibility that we could run short on this and other supplies. And so it's important that across the nation, big city or small, that hospital systems are paying attention to their supply chains.
In order to bolster production, the US Department of Health and Human Services announced it would place an order for 500 million medical-grade N95 masks. But that will take time to be processed. Although the management at this particular hospital is confident in its own supplies, there are reports that some US hospitals are already rationing masks, and those concerns are expected to deepen the longer this pandemic goes on. But it appears medical staff are already learning from their COVID-19 experiences.
We need to start limiting the number of healthcare providers, so vitals checks, things that are non-essential can be cut out. So delivering a lot of care at the same time. So if we're going to bring a meal to a patient, we're going to check vitals, having the same person, one person go in and enter instead of multiple people doing the task that one person can do and using, just a way of rationing without causing harm to anyone.
There has also been a sharp consumer demand for masks.
At a peak, maybe 2 weeks ago, we were going through over 100 boxes a day.
But as suppliers focus on providing masks to where they are needed most, the chances of retail pharmacies getting fresh stocks appear slim.
It's gotten to the point where all of our distributors, they no longer have them in stock. And if they do, they're allocating them to more important places of business, such as hospitals and doctors' offices.
If shortages worsen, the US Centers for Disease Control and Prevention has issued guidance on extending the use of existing masks and reusing them where medically possible. But it's hoped with production ramping up, it won't come to that. Dan Williams, CGTN, Chicago.